I've been suffering from insomnia for a while now. I keep finding myself struggling to sleep. I keep waking up in the early hours of the morning. Eventually when I do get to work, I'm struggling to concentrate. To help me fall asleep, I've been using Nytol. I've moved up from 25 milligrams to 50 milligrams, but I feel like I'm too dependent on it. I'm struggling to sleep when I don't use Nytol. I've heard CBT is an effective long-term solution for my insomnia, and I think that having this in my local pharmacy would be a great idea.
The Sleep Clinic is a service aimed at treating long-term insomnia. It consists of 4 face-to-face consultations over the course of 4 weeks. This will begin with an introduction to the service. Patients are assessed by the pharmacist for eligibility based on symptoms and medical history. The pharmacist will use their clinical and professional judgment to refer to a GP if a secondary cause is suspected. After briefing the patient, they will be asked to complete a questionnaire on their symptoms. This will aid in diagnosis of insomnia and help the pharmacist measure progress made by the patient after future interventions. They will also be asked to wear an Actigraph device, a well-established diagnostic tool used to monitor the patient's sleep cycle through movement. Actigraphy is a convenient method of accurately measuring sleep and will be used to tailor treatment to the patient's sleep pattern. The patient must also complete diary entries outlining their diet, activities, as well as sleeping and waking times. These tools will be used to decide on the best course of action, which will be based on non-pharmacological treatment, including sleep hygiene measures and a variety of cognitive and behavioural interventions. Telephone consultations by the pharmacist will be used to measure the patient's progress and adherence to treatment, in addition to collecting feedback on our service.
So with anyone who comes into the pharmacy complaining of insomnia, first we will offer lifestyle advice. If that hasn't worked, then we would recommend an OTC preparation such as an antihistamine. If they are still complaining of insomnia troubling their lifestyle, then we would refer back to the GP for a consultation. Insomnia is one of the most common conditions we come across in community pharmacy, and there is a very big need for it to be addressed. Currently, there is no long-term OTC treatment for insomnia, but from the GP they can be prescribed drugs such as hypnotics, but this in the long term is not really sustainable in a patient. Wow, I think that's a really good idea. Incorporating sleep clinics into community pharmacy, it gives us the opportunity to work with other healthcare professionals such as high intensity therapists to use CBT to tackle long-term insomnia.